There's limited data to understand the impact of HIV on cervical cancer patients, especially in light of treatment for locally advanced cervical cancer with chemoradiation. And this data is even further limited for HIV positive patients in the modern era who've been on treatment for their HIV and have been well managed in regards to their HIV. So this study is really geared at looking at impact of HIV and on outcomes of patients with cervical cancer who are being treated with definitive chemoradiation. So these are good performance status patients who are doing really well with their HIV, which is typically what we see in the modern era for patients with HIV. And what we found was that HIV doesn't negatively impact your outcome for cervical cancer. And so if you see a patient with HIV and locally advanced cervical cancer, they should be treated just as aggressively and just as you would treat a HIV negative patient. So moving further with this line of research, what we're looking at in the next few years is the impact of immune status on treatment tolerability and outcomes of patients with HIV and cervical cancer, and then also looking at cost-effective and easy-to-use tests to assess treatment response in HIV and cervical cancer, specifically geared towards sub-Saharan Africa and India.